Hello, I'm Dr. Tait, Regenerative and Functional Medicine Specialist here in Tucson, Arizona. And today I wanted to share something that's very near and dear to me. It's actually a framework, a process that I've been working on in my practice here over the past 4.5 years now into our 5th year. And it's really a system that I use to evaluate patients that come to seek us out for situations where maybe they've been in pain a long time, they haven't been able to quite fix that problem. They've had a lot of treatments given to them. Many of them are symptom-based treatments because they were basically told there was nothing else that they could do for them, or they're looking for an alternative to address the pain that maybe doesn't involve a surgical intervention. So I wanted to give you a little sneak peek inside this framework that we use to evaluate patients, what we walk them through in our initial consultation. How do we get to those deeper root causes of pain and inflammation and factors contributing to that ongoing pain that they're having, and really develop a long-term solution to it rather than just masking the symptoms. So without further ado, here's the process. So we call it the pro-mend process. The reason for that is our body has this incredible innate capacity to heal itself or mend itself. So if somebody's coming in to see me, say for knee arthritis, very common issue that presents in my consultation room multiple times per week, oftentimes they're told this is a degenerative process. Your knee just wears out, the cartilage wears down. And it's not completely true. There are several other metabolic, we'll call them biochemistry type factors within the body that influence that joint, provoke more inflammation, provoke more pain, and yes, can contribute significantly to the rate at which that arthritis deteriorates that knee joint over time. So what I do a little bit differently is I spend a lot of time in the first phase of our treatment, which is the preparatory phase. So that's step 1 here, preparation. In this step, I like to think of this as a base camp step. I like to hike, go out in the mountains, do things, and sometimes we find if we jump right out there and try to go right to the top and we don't acclimatize a little bit first, we're going to have some real problems. So in this preparation phase, we're learning a lot about that patient, the root causes maybe that got them there, some of the prior injuries, accidents, contributing factors, but then digging deeper into that biochemistry. And what do I mean by that? Well, there's several different factors, and the first one we look at with everybody is really nutrition. So if you have issues with nutritional gaps, your body's just flat out not going to heal, right? It's vital, right? Vitamins, vital, we need them. They need to get into the cells. They need to power these chemical reactions. They need to help these cells turn over and regenerate. If we don't have the nutrition we need in the proper balance within these cells, well, that can dramatically influence the rate at which things deteriorate. The next step that I evaluate that goes hand in hand with that is the GI system. So again, if we can't absorb the nutrition we're putting in our body, we can't push that nutrition into the cells. And the second piece is really the microbiome. So we hear a lot about this. What does that mean? It's the complement of bacteria that we have living in our gut, and that really keeps us healthy or not. It influences a lot of other systems in the body, including your immune system, which can be a driver for inflammation. So we evaluate that second. The third step is we're going to look at food and environment. And we're going to look at the sensitivities or the allergies. You know, allergies are a spectrum. Many people can have sensitivities to food. They can have intolerances to food, like lactose intolerance. But these things can be drivers for inflammation. And many people try to figure this out on their own. They work through an elimination diet. But ultimately, to get to the real root of it, for a lot of patients, we have to do some testing. So we'll get some specific testing on it to see if that is a contributing factor to people. The other thing that we're going to discover as we're working through some of this is there may be some other toxins and other things on those labs when they do come back that are contributing factors for those patients. So we want to identify those. Sometimes it's kind of a mystery to figure out what is going on in our environment that could provoke some real problems there. So we want to know that. And the last piece that we'll get into with some patients is really looking at genetics. So the genetics can really influence often many things that are going on in our body. Obviously, it's the genetic code we're given. But these factors here, if we look at them, these are the epigenetics. So we think about genetics as your hardware. We think about all these other factors, your environment, things around your genetics as the software. So we have the ability to change that based on the choices we make, the nutrition we put in our body, the other things that we do to help the body heal. So if we know these things and we can start to fine-tune those things, we get the body prepared in a state that it can actually heal and repair and regenerate. Because believe it or not, the default in your body is to regenerate. These cells are going to keep turning over until you take your last breath. So the question is, how are they turning over? What types of cells are we rebuilding? How healthy are they? How resilient are they to the demand that we want to put on them? So again, garbage in, garbage out. If we're putting garbage in our body, that's probably what these cells are being remade, regenerated, rebuilt with. So really super important that we look at that. So that's step one. The second piece that we move to is actually the repair phase. So